Things can only get better with greater care in the community, but watch out. There's a mental health crisis going on as well. Watch this video. Hello, welcome to the channel. I hope you're all well. So recently, the government in the United Kingdom talked about reforming the NHS and putting more care in the community, more services in the community, effectively to relieve the pressures on the NHS itself, and also especially the pressures on hospitals and bed blocking as well. We've got winter approaching as well, which is always a high pressure environment for the NHS here in the UK. Put more care in the community definitely works, definitely helps. But there's a big problem in the United Kingdom. In fact, there's a big problem in many parts of the world, which is rarely talked about, and that's a mental health crisis. This is one thing that I've always thought that actually in many ways is the most critical thing to address in society. Now, mental health issues are so broad-ranging, of course, and there are many behaviours that may be labelled as mental health, but not actually mental health. There might be other social issues going on as well. But regardless of whatever the situation is, there is a high correlation between mental health and certain crimes. There's also a high correlation between mental health and people who are homeless as well. And the common denominator here is that the care in the community doesn't target those people, doesn't help those people enough. In fact, for many years, there wasn't really a system to help people with mental health issues. Now, of course, in the most serious cases, there's going to be a pathway, but many people just are swept under the rug. Many people are just totally missed as well. Then it's not that they're ignored, that they're just not even identified in the first place. So when a UK government talks about NHS reform and talks about care in the community, this is where I see one of their priorities need to be. After COVID, after the pandemic, one of the greatest issues facing the NHS wasn't really the lack of funding, which everybody talks about, wasn't the increased pressure from people going back into the hospitals and going to see their doctors after they could stop social distancing and all that kind of stuff. It wasn't that. Actually, the unsung issue here was the mental health crisis within the NHS itself, amongst its staff. Many people just got totally burnt out. Many people were getting off from a depression. Many people were just leaving the NHS after feeling hard done by for lots of different reasons. When the COVID was going on, lots of people were thanking the NHS and there was public applause and everything like that. But people within the NHS were actually suffering daily. They were having to deal with this on a frontline basis. Everybody outside didn't have to deal with it. They were actually deal with it. They had to still go to work. And those very early stages, they didn't know what was going on. They didn't know if they were putting their own lives at risk, which they were really, because they didn't really know what was going on. This has caused a catalyst in a deterioration of mental health amongst NHS staff as well. But that's just one sector of the community. Now you're talking all sections of the community, and the mental health situation has definitely got worse in recent years. If you can consider what you can physically see on the street, in some parts of the country, you can definitely see that there seems to be much more homelessness, in certain cases, certain crimes as well. Now, that could be related to lots of different things, of course, social issues, unemployment, so on and so forth. But there does seem to be clearer evidence out there of what is reported in the media as well, of atrocities that take place as well. And then you find out that somebody has got mental health issues, and you think, why hasn't this been addressed? Why hasn't this been dealt with in the past? Why hasn't this person been helped so they don't commit these certain crimes? If you go to other parts of the world, they've got homeless people all over the place in terms of, big cities, and it's just getting bigger and bigger. You talk about places like Los Angeles, it's just all over the place. San Francisco was another place that just got blighted by homelessness as well. Any big city has this now, and you can rest assured that within those communities, that mental health is a big issue. And a common denominator within that scenario is that people just can't get help. They weren't being helped. So the greatest care in the community, of any community around the world, should be addressing not only the physical issues that people have to deal with or are suffering from, but it's the mental health issues, because there's a huge mental health crisis, not only in this country, but in other parts of the world as well. If you like what I do here, just keep on watching the videos, and I'll catch you again. Bye now.